Health Minister Dr. Zweli Mkhize says poor management in that province is compounding its health problems. Now there's a dire shortage of oxygen tanks. Dr. Mkhize has concluded his two-day visit to the Nelson Mandela Bay Metro to assess hospital conditions. Last week, a BBC investigation drew worldwide attention to the Eastern Cape's so-called hospitals of horror. To discuss, we're joined by Professor Alex van den Heever, who is the Chair of Social Security at the Wits School of Governance. Professor, thank you very much. We've spoken to you before, and you've said that the lockdown, especially those first 3 weeks, were not put to good use. Do you feel that what's coming out of the Eastern Cape, all right, it looks like we have lost the professor. What a pity, we'll keep trying. This is the joys of television in COVID-19. We try and do things remotely, having a few technical glitches. But just apparently the professor is back. That's great news. So, Professor, I don't know if you heard me, but okay. You have been critical in the past, saying that the lockdown wasn't put to good use. Do you feel you've been vindicated?
I think that the lockdown has clearly not been used effectively in most provinces. And rather than being vindicated, I think that what really needs to happen now is a very intensive focus on suppressing the epidemic. I think we're seeing some evidence of that, but I think that we've really lost quite a lot of ground, which we have to catch up.
Yeah. Well, surely it depends how much oxygen was available, how much money the province had to buy the oxygen. I mean, do we have that sort of information? What hasn't been done up until this point? And then we will talk about what should happen from here on.
I can't believe that there was a financial constraint. I think the financial constraints have to be taken up to national government if they're going to place the public at substantial risk. So I don't believe that it was financial constraints. I would argue that in the Eastern Cape, it is primarily incompetence that is to blame. Agreements with the private sector were not put in place. No contingency planning was in place. The field hospital arrangements, apart from the Volkswagen complex, are laughable. So I think that there should be consequences for that top management team. And I think that that's really what is to blame. It is not resources. It is not acts of God. It is entirely the capabilities of that province.
All right, the Premier, Oscar Mabuyane, now says they are working with a gas supplier, for example, to establish bulk oxygen banks in all the district hospitals. So even if it comes late, could there be a scramble now that really could help protect lives?
Well, I think now they have to do everything, and all hands have to be on deck to make sure that whatever needs to be done is done now to address this particular problem. It beggars belief that after the lockdown in March, none of this was even thought of as necessary to plan for in advance. When I look at other countries and even other provinces in South Africa, their contingency planning had thought through all of this in advance. But it is completely unclear now why we have to scramble at the last minute to try and get everything together. So I think it is. I think that basically we have to solve the problem in front of us at the moment, but it is a scandal that we have to respond in this way.
Does the health minister have a point? Today he delivered his budget. In the vote, he was saying that asking the department to fix all of its weaknesses across the country in 5 weeks was expecting too much.
Well, I think it's there are many. A lot of the problems in the health system are not short-term in nature, and I think that in the case of an epidemic like this, quite a lot is naturally centralized to avoid having to deal with differences in capability across services and across platforms. So I think there is a question as to what the executive structure should be in the case of an epidemic and to correct those problems immediately, because a lot can be verticalized. And a lot of countries verticalized programs immediately to achieve more rapid responses more uniformly across a country. African weeks.
Professor, we lost you just for a few seconds there. I hear what you're saying, that some of this could have been foreseen, disappointing because so many people were involved. Let's just look at some of what's happened, what's been said about the Eastern Cape after the BBC exposed rats sitting in the drains, patients sleeping under newspaper. The health minister announced that they will look for new managers, specifically for Livingstone Hospital, that was featured. Apparently, the hospital's permanent management was suspended in 2018 after a strike by Nahawan members and never replaced. Is that alarming to you?
It is. I mean, look, if you go across through the Eastern Cape and look at the reports, the report after report after report of systemic failures in hospitals, different hospitals across that province that have never been addressed. And in my dealings with people who've been managing within that province and have indicated that there is systemic, endemic corruption that has never been addressed at a political level, either nationally or provincially, and that essentially national government has turned a blind eye to dealing with what is at the root cause of the failures of the province. We're seeing it come out now because you cannot have corrupt administrations respond effectively to population's needs. And that's where it lies. That's where the problem lies, and it hasn't been addressed. And it's caused most of Eastern Cape's hospitals to fall into disrepair.
So the health minister raised the issue of managers in hospitals, saying you needed to know what was going on and do something about it, looking at those managers. But tell us more about your opinion on how government has fared National Health Department. I mean, we see the minister visiting hospitals, but they know he's coming. Surely there could have been spot checks for years.
Yeah, you don't use spot checks. What you do is you have a coherent governance framework that institutionalizes performance. Now, that seems like a sort of a lengthy comment, but essentially it means that you have supervisory structures that are implemented that actually sever the relationship between politicians and the executive structures of government. And we don't have those, so it's very difficult to hold managers to account. And the appointments of people across a province like the Eastern Cape, and it's not unique to the Eastern Cape, are the wrong people. And even when you have the right people, they're not held to account in a properly designed structure. It's not going to be corrected by a minister going around looking for photo opportunities at a facility. You've got to have a systemic response to a systemic problem, and we're not doing that at this point.
And finally, can we agree that you can't only blame the ANC government here? Eastern Cape, there's been years of governance problems, maybe coming home to roost now, the ANC, the DA, the UDM, all involved over time.
Well, the UDM and DA were only involved at a municipal level. These health services are a provincial competency. And really, there are two major functions at a provincial level, basic education and healthcare. There are other functions that are important. You get those two wrong, you're not doing your job. And healthcare in the Eastern Cape has been institutionalized failure for a long period of time. And it's not addressed. But Eastern Cape is not unique. They are just one example. Free State is also deeply problematic. Northwest is deeply problematic. Northern Cape is a problem. And Gauteng is just slightly better than many of those, but also very problematic.
All right, let's leave it there. Professor Alex van den Heever from the Wits School of Governance.